Hello, fellow classmates. This is our last semester. Yay! So this is hopefully my last and video of introduction. This is the introduction video 4502 nursing leadership class. Yay! Fellow classmates, my name is Blanca Martinez Torres. I'm sure that most of us have gone through some classes together this year, finishing up. I live in El Paso, Texas, and my nursing practice is in the area Family Practice Community Health Center. So what does that mean? It means that as a clinical nurse for family practice, I get to do everything. I'm the prenatal nurse, I'm the immunization nurse, I am diabetes nurse, education, I do laboratory, so phlebotomy is part of our, part of being a clinical nurse. Surgical nurse, adult chronic conditions, pediatric, like I said before. What else? What is it? Everything. That is what I really love about being a family practice clinical nurse, is that I never get bored of being having different areas that I have to know about, and it keeps me on my toes. I have to be up to date on things. We're always reading up, and then being on one-on-one with the providers when it comes to care of the patients, and triage nurse, obviously. So that is what I do at this time. But part of being a nurse, I'm also the nursing director for my clinic. The organization that I work for is a community health center, in which we have seven clinics already, and so we're part of the whole group. So each clinic has a nursing director, nurses, and then assistants or MAs, and so we're all connected. We're all under the same group. So the same thing as my staff will get rotated to another clinic, or if I get called out to take over another clinic because there's no licensed nurses there, we're all part of the bigger organization and the nursing pool. So it makes it very nice that we are part of a bigger family, but at the same time we have a lot of things that we do because we are a federally funded community health center. We have to be accredited by the Joint Commission, and so on and so forth. So that means we get to do a lot of paperwork, a lot of reports, a lot of logs, a lot of everything. But it is what it is. We're all in the same thing, all our big organizations have to follow the same rules. So that is what it is. So I obtained my first associate degree in community college as a dental assistant, actually, in 1992, and I was working in El Paso for a community health center in El Paso too, in downtown. If you all live in El Paso, you probably know which one I'm talking about. The community health center in El Paso, there's only one. So I worked there, and then I transferred, and then I got a job at where I'm working now at over here in New Mexico in 1999, and also as a dental assistant, and which I loved dentistry, but it had its limits, and so it was time for a career change that we all do as adults. So I decided to go back to school. The wonderful thing about the organization that I work for was that at that time they have a sponsorship program that assisted me while I was going through nursing school at El Paso Community College. Part of the signing your life away was that you returned back and you did your time, for their assistance, which really helped a lot, because as we all know, that most of us, when we're going through it the first time, you can't work sometimes, and you're you're really strapping for financial stuff. So that really assisted me in finishing and completing my RN at El Paso Community College in 2007. So upon completion of that, I came back and back to work, and I started working as a clinical nurse for the organization that I work with. And then in 2009, I took the job of the nursing, the clinic nursing director for the clinic that I am in charge of, which is what I have so far. I've been in the same position. So part of what I had said before that I do on a daily basis is that my administrative duties as the nursing director is that I'm the teacher. I supervise my nurses and my aides and my MAs, my doctors. So we all know that, and but I'm also the safety officer, the infection control officer, the quality assurance officer. All of that is put into our domain of supervision and making sure that everything is up to par, because we are part of the bigger organization. Obviously, it's not just myself. Like I said, every clinic has their own nursing directors, but when we all get together, we're all talking about protocols, procedures, so forth and so on. It's never ending when it comes to administrative work and making sure that the clinics are running the way they should be. We are HR, we're having to make sure that our clinics are being filled, so we're doing nursing schedules, and it sounds like wow, but we get it done, and I love what I do. I love working for the organization that I do, and I believe in what we do as a community health center. We are of last resort, so we get unique situations where your nursing really comes into play for the patients that we care for. But I am very happy that once I also decided again to finish my BSN. I know that if I ever leave this my organization, if I want to take another position somewhere else, I know my BSN will be required. And so here we are, and hopefully we will be done with this last class. Yay! So good luck to all of us, and we'll see you all in graduation and our discussion boards. Goodbye.